Struggling with back pain as a woman? Well, it's time to take action. Take charge in 2025 to really get over your symptoms and fix it for good. Today, I'm going to talk about the common causes of back pain and what you can finally take into action to fix your problem this year in 2025. My name is Dr. Dawn Andalone. I'm a women's health physical therapist. And as a physical therapist for many years and working in the realm with treating tons of back pain and pelvic issues, I know that many women deal with back pain on and off throughout their life. It's actually one of the most common things that we deal with over the age of 40. And in this video, I'm going to talk you through some of the things that I know have helped thousands of women that we have worked with in person, and what you can take with you today to start helping your problem and get over it for good. Now, back pain being incredibly common, especially for women, can have to do a lot with hormonal fluctuations and changes in your body, especially from that time of after pregnancy and beyond, and then also from the perimenopause to menopausal stage. And what these hormones can do, they can actually weaken the ligaments, causing some destabilization of the spine. So therefore, muscle support and control of the muscles around your spine is the most important thing to help combat those hormone fluctuations and changes. And then if you've gone through pregnancy, it does change the center of gravity. So therefore, when you're carrying the baby in front of your body, it's changing that position in your spine and putting more stress on certain areas that you didn't have stress on before in your lower back. And then from postpartum stage, as your body has changed and now you're lifting the baby, carrying the baby, and doing a lot more manual labor with the baby, and your ligaments have weakened, it does require more support of the muscles around your spine because those ligaments are a little bit weaker at this stage. And then poor posture. Over time, poor posture is going to put strain on different areas like your neck and shoulders, your lower back, and your pelvis and your hips. So poor posture is going to put a lot of strain on certain areas of your back and therefore creating some extra wear and tear on areas down the road. So when you're in your 40s, 50s, 60s, and you're finally getting this back pain, it could be years of poor posture or bad habits that are leading to the back pain. And then there's also pelvic floor dysfunction. So your pelvic floor, these muscles in red at the bottom part of your hip bones here, and those pelvic floor muscles, they're very important in supporting your pelvic organs, but not only that, also your whole pelvis and the bottom part of your spine as well. So if you have weakness of those pelvic floor muscles or any tension and they're not working properly, maybe you're having some bladder leakage or other unwanted symptoms, that can also lead to having some back pain too. And sometimes it is misdiagnosed that you're having back pain, but it could actually be the pelvic floor as the problem to be treated. And weakened pelvic floor muscles can also destabilize the spine when you are doing heavy lifting or you're running and putting a lot of stress on the pelvis, but therefore your back doesn't have that same amount of support because your muscles are weaker. And lastly, stress or age-related degeneration. This is inevitable, and over the age of 50, we start losing some of that space between our discs in our spine, and therefore those joints can have more irritation or start getting some arthritic changes around them. So no matter what, this will happen over time, but you can do the prevention and do a lot of things that are going to stop some of that wear and tear and stress on the discs, on the ligaments, and the joints if you take action and take control now. And managing arthritis and those changes down the road, the more support you have in other areas around your core and your pelvic floor and your muscle system, the better the outcome and the more mobility and functionality you're going to have if you want to stay active as you're aging. So how do you know if your back pain is serious? Well, if you're getting pain down the legs, that is obviously a very serious issue, or you're having any numbness or tingling in the legs, then you definitely want to get checked out by a doctor and make sure that there's nothing else going on. But besides of that, if you're getting pain, if you're sitting for prolonged periods of time or standing for prolonged periods of time and your back starts hurting, well, you may want to do the right types of exercises that are going to have more muscle support and stability around your spine, because it gets tired and you lack endurance from your lower back. And if you're having a lot of stiffness first thing in the morning too, this is another red flag that you have something going on in your back and you need to address it. So let's talk about solutions, the best part. So what can you do today? Well, start addressing the muscle system around your spine. This is truly what we call the core. We're not just talking about your abs and doing crunches. No, I'm talking about that whole system with your back muscles, your deep abdominal muscles, your breathing muscles, your diaphragm, and your pelvic floor. It all needs to work together in a system to really provide that stability and support around your back. So something like Pilates-based exercise done guided and more therapeutic approach and starting off in some beginner exercises can be very helpful. And Pilates-based exercise is going to address breathing, alignment, posture, and also give you flexibility and the core strength that you need to learn how to have that translate over into your daily life and your posture. Whether you're sitting in the car, standing in line at the grocery store, you're gonna have more support and stability around your spine if you're doing exercises regularly. And regularly, talking about at least 2 to 3 times a week for at least 6 to 8 weeks to notice a big change in your results. And if you're having any major pain or discomfort, visiting someone like a physical therapist or doing a customized expert type of program with an expert physical therapist, they're going to be able to pinpoint why you're having back pain, where is it coming from, and what are the best exercises for you to be able to solve it. Improving your posture is also part of that journey and working on the right types of exercises, but improving your posture has to do with the ergonomic setup. Are you sitting at a desk that is set up correctly? Maybe you're in a really low chair or a chair that's not giving you a lot of support in your lower back and you need a little cushion or a pillow or something that is going to give you more support. Maybe you need to switch between standing and sitting. Maybe you need to adjust the seat in your car. So really taking a look at where you're spending your time throughout the day, what keeps irritating your back, and how you can make some adjustments to take pressure off those areas that are getting irritated. And therefore your muscles don't have to do quite as much work because you have the right support behind your lower back. Now, staying active, things like walking and swimming are going to be very helpful for your lower back. You also want to make sure you're doing those guided therapeutic type exercises, whether you have some Pilates exercises to follow through with an instructor or doing some at home, but getting some cardiovascular movement with walking and swimming can be very beneficial to get the blood flow and circulation and also help lubricate those joints as you are doing the movement. Nobody's back likes to stay in one place for a really long period of time. So that movement not only helps you with your metabolism and weight loss, but also it keeps your joints and your back feeling better as well. Then if you're having a lot of added stress in your life, so maybe something is going on where you're thinking about it too much, or you need to find some areas of practice that are really going to address the stress in your life, some mindfulness activities like some yoga or some meditation, taking walks with some music, practicing these relaxation techniques or journaling. These things are going to downregulate your nervous system, which is so much related to having back pain. And when you're in a high state of stress, then your muscles can create a lot of tension and also can have that overlay into having more back pain too. And then last I'm gonna say is finding supportive footwear. So if you're walking around barefoot all the time at home, maybe you have hard tile floors and you don't have supportive cushion under your feet when you are walking around, on a tile floor, it can put a lot of extra stress from your knees to your hips and all the way up into your spine. So making sure you're wearing comfortable, supportive footwear, especially if your back seems to be flared up, this can take some of that pressure and shock absorption and create less pressure on your joints as well. So now let's set some goals for this year in 2025 with your back pain. So number one, exercise regularly. Stay active to reduce your back pain and just stay ahead of it. You may notice you might have one day where you're traveling in the car or you're sitting for a long period of time, and the next day your back is really flared up. So keeping a journal, paying attention to when your symptoms are flaring up is really important, and that way you can stay ahead of it and also just find time to be more mindful about movement and getting more movement in your day. Number two, self-care. So reaching out to either get a massage, going to see a physical therapist, a practitioner that is going to be able to do some hands-on soft tissue release and address your back pain. Self-care means you are giving yourself some love and support and guidance, and sometimes you need an expert that is going to be able to give you the right things to guide you in the right direction and speed up that process for you. Taking care of yourself. Go to a Pilates class, a yoga class, something that you have been instructed is going to help ease your back pain and calm those symptoms. You have to take care of yourself. And last but not least, but small changes and consistent effort over time is what's really going to fix back pain. There's no magic solution. And if you're someone like a lot of the clients that we see that want to avoid invasive measures like surgery or injections, then staying consistent with the right types of movement practices and lifestyle changes over time is going to make the biggest difference, I promise, in your back pain. But you do have to be patient. So small changes with consistency, you're going to see big results in the next couple months. Now, I hope you found this video helpful. If you like this video, please hit the button and subscribe to this channel. And I release new videos every week, all about other topics related to women's health and wellness. And I wish you healing in your back pain, and I want you to find relief. So thanks so much for watching, and we'll see you again.